A heart attack is a condition where the artery in the heart supplying the heart muscle suddenly becomes completely blocked. So whatever is downstream to the blockage, the heart muscle starts to die because there is not enough oxygen. And we know from studies that once this has occurred, the muscles that are downstream to that artery blockage will be dead, completely dead in about 12 hours. So, and that's why when a patient comes in with a heart attack, we need to do things as quickly as possible. In the old days, the treatment to reopen the artery was to give a very powerful blood thinner, what we call a fibrinolytic agent. This would be able to open up the artery in about 2/3 of the time, but the downside of this therapy is that it increases the risk of bleeding quite significantly in many patients, and that includes the risk of bleeding in the brain, which itself can be fatal. So nowadays what we can do for these patients is we do an emergency angioplasty for them, whereby we transfer them quickly to the angiographic lab, and we perform emergency ballooning to then reopen the artery and re-establish flow. And the earlier we open it, the more heart muscle we save, and thereby the term time equals muscle comes in. Because if you do it very late, 8, 10, 12 hours, you're saving very little muscle, and most of the muscles are dead anyway by that time. So the earlier we get to the patient, the more muscle we save. So maybe they have heart attacks in different arteries or different branches of the 3 arteries at different times in their life, and this actually contributes to muscle death and then subsequent weakening of heart muscle and heart failure. If everybody understood that, we could actually do a lot more good for patients who come in earlier with heart attack.